Hi, and welcome to another Medical Office Force informational and instructional video. Today, we're going to discuss TCM, Transitional Care Management. A transition from what, you might ask? Inpatient hospital discharge, hospital observation status discharge, discharge from a skilled nursing facility. When one of your patients is discharged, it's your job to prevent readmission for the patient's sake and yours. As a result, the patient will have better care, Medicare will save money, and you will be rewarded. Yes, more revenue for your practice is a great thing, but let's think about the bigger picture here too. You're helping to save Medicare. You're helping to solve the biggest financial problem of our country. You are ensuring that medical care will be available in the future to those who need it most. You are the change that we all need. This isn't just about your practice. This isn't just about your patients. This isn't just about Medicare. This is about all of us and the future generations of this country who need your help. It's a privilege to share this information with you. We want to make it as easy as possible for you to get started. That's why we've made this video. And let's be clear, if you are not currently doing transitional care management, you are losing money. It's money that Medicare has already allotted to your practice for this service. For the patients you already serve. You may even already be doing this service in one form or another. Either way, this money belongs to your practice. Stop letting it slip through the cracks. This video will show you how to stop losing your money and start claiming what is yours. So, let's get started. When your patient is discharged from the hospital, it's your job to prevent unnecessary readmission. Your discharged patient will need to be managed for 30 days. Medicare will reward you for managing your discharged patient for 30 days and documenting the process. So what does this management entail? Well, number one, you must call your patient within 2 business days from the discharge. Later in the video, we'll discuss how you can know exactly when one of your patients has been discharged. Number 2, you must document why your patient was discharged. Number 3, you must document your patient's medical reconciliation. Number 4, you must see your patient in your office for a visit. Number 5, you must document the discharge diagnosis. Transitional care management can only be done by one provider. To be successful, your office must be organized, trained, and prepared to handle transitional care management. As we mentioned earlier, your office will be rewarded for its success with TCM. Medicare has made it easy by providing us with codes for billing a successfully completed transitional care management period. Code 99495 will earn your practice $117.13 for office visits within 14 days of being discharged. Code 99496 will earn your practice $244.20 for office visits within 7 days of the patient being discharged. The average practice with about 500 patients makes an average of $28,500 a year from transitional care Management. And that's with only capturing about 60% of the potential business. Why 60%? Well, there are some challenges when it comes to transitional care management. For example, you must bill exactly on the 29th day after the discharge date for a total of 30 days of transitional care management. Now, here's a warning. This date may occur on a weekend, holiday, or some other time where you or your staff may not be available. If this happens, you must bill and hold. Keep track of these dates with a spreadsheet. If your bill comes back denied for wrong date of service, just fix the date and bill again. More challenges include another provider may bill for your service before you. Your patient may be readmitted to the hospital. If your bill comes back denied for either of those reasons, simply change the code to 99214 to bill as a regular office visit. Now, one more big challenge is knowing when your patients are discharged, especially when they don't tell you. So here's the solution. Most hospitals have a portal that will allow you to log in and check your patient census. Log into that portal each day and compare your census to the previous day's census. This will tell you which of your patients have been discharged from the hospital. You then have 2 business days to call that patient and schedule them for a visit within the next 7 business days if possible, or within the next 14 business days if that is the best you can do. Remember to document everything we've mentioned in this video. Help your patient to stay out of the hospital for the entire 30-day period unless readmission is really needed. Educate them on what you are trying to accomplish for their benefit and everyone else's. Explain the other options available to the patient. What are the alternatives to costly hospital readmission? Can you or your staff be made available after hours to answer questions and give direction? Here's a tip to help your patients make better choices. Give each discharged patient a card with their options and a contact number for help, should they need it. That's it. Now you know exactly how to start doing transitional care management in your practice. You know exactly how to start paving the way to a better future for healthcare in this country. You know exactly how to stop losing your money, just as promised. Still need help? M-Force will help your practice get started with transitional care management. M-Force can train your staff. M-Force can bring you more data about your Medicare patients. M-Force will help you to improve your transitional care management continually until you are losing no money at all. Sound good? Click the button below this video to be directed to a simple form. Fill out that form and M-Force will contact you to discuss how they can help. We look forward to working with you. Thanks for watching this video.